welcome to the Coronavirus Update Show. My name is Omari, Salisbury.
And I'm Nikki Barron.
What's up, Nikki?
Yes, working. It's been a big COVID news day, actually. I don't know if you saw, but Inslee extended the stay-at-home orders an additional week. So that, I thought it was going to get lifted on January 4th, but now they're saying January 11th for that. So, yeah, it's been a big coronavirus news day.
So it's gone from the 4th to the 11th.
Yes. So here in the state of Washington, they are asking everybody to stay home and really hunker down for an additional week, January 11th.
What did the governor give a reason why?
It's working. So it's working. The number is going down. We are, staying under that 80% hospital readiness. And so because it's working and there's new strains, they found another mutated strain that is also super contagious in California. So they just reported that today. So with these additional strains, it's just in our best interest to keep staying home because it's working.
Right, and so we do realize like how confusing that messaging is, though, right? Is because it's like stay home until the 4th, so we can bring the numbers down, and now the numbers are coming down, and they're like stay home until the 11th because the numbers are coming down.
Yeah, it gives us a little more wiggle room, and I think also probably with this is just me guessing, but I would guess that part of that comes from these two new strains being discovered here in America, wanting to see how that kind of shakes out in these other places where they're finding them. So I think it's just out of an abundance of caution, but it is working, and we do have really good numbers in comparison to a lot of other places.
Wow. Speaking of numbers, what numbers do you have for us today?
Yeah, so let's jump right into it. They just did a refresh of the numbers this afternoon about 4:30, and we had an additional 1,526 cases reported. 51 more Washingtonians lost their lives to the coronavirus, and we had 126 additional hospitalizations since yesterday. And the one good thing we do have is our readiness. So we're doing okay, staying in that 80% range. It's 82.6, which is worse than it was reported yesterday.
But it's something happened because it went from 83 down to 75, then to 77, and now 77 this morning, and now 82.
Right. That's still pretty good as far as capacity goes. So, I think at one point, King County, when I looked, was kind of hovering at that 82 when the rest of the state, kind of average was less than 80. We were still at like 82. So it's definitely still manageable for us to have that 82%, but we want to keep it down. Hence the continuation of that stay-at-home order.
Wow. What kind of feedback have you seen, maybe online, if any, since the governor made that announcement earlier today?
Not much feedback, really, honestly. People were just sort of like, we kind of saw that coming. I think that's become the pattern of the governor when it comes to this. He announces like just enough to get people to listen, and give us a little hope at the end. And then he like gets close to the end and he's like, oh yeah, I'm going to extend it. So we've kind of been experiencing that all year. I don't know anybody who was surprised by that.
Yeah, I don't know anybody that I talked to that really felt the January 4th was going to be the actual date that this order was lifted. And especially when you talk about going into these holidays and everything else, I could really see Governor Inslee in a week being like, well, because of New Year's or this or that or anything else, we're looking at like February 1st.
Yeah, it's a hard one because we've been doing this dance for going almost a year, and we're all pretty exhausted by it, but it works. So it's like kind of this like double-edged thing where we're like, okay, this works, so we keep doing it, but then we're also like, can this please just be over? And it's really interesting because I know the vaccine is sort of the light at the end of the tunnel when it comes to the pandemic and the stay at home. But I actually just saw a statistic today that said that even though we received almost, I think, 400,000 vaccines, we've only distributed about 20% of them so far. So
Yeah, well, the whole country is behind. So here's an issue with the vaccine is that they said there was going to be 20 million people vaccinated by tomorrow. And right now
yeah,
they're saying that it's 2 million. It might be lagging numbers. Even if it's 3 or 4 million, it's nowhere close to the 20 million. And there's all these issues in rolling out the vaccine. I just read an article that down there in Florida, it's different county by county. And in one county down there in Southwest Florida, it was like, hey, first come, first serve. And you had elderly people waiting outside of this vaccination clinic. One guy said he got there at 1 in the morning. He waited 8 hours outside of this clinic, and I think the clinic only had like 100 or 300 actual vaccinations that they could give. And he was like, I'm elderly and everything, but I could sit out here. But he was like, what about people that are homebound? What about people whatever? And I think one of the issues that we're facing here, especially if you look to other countries and things, apples to oranges, but because there's not a unified health system here, when you look at, like, I think they said Israel is like 638 people per 100,000 getting the vaccine, and then behind that's the UK, and then after that is us.
yeah.
And then even after us is Canada, which is crazy. And Canada bought the most vaccine. They bought up vaccine. They bought up 5 times their population's worth of vaccine, and they're the slowest at getting it out. And then right after them, it's us compared to industrialized countries. So it's still all these other issues with the vaccines there. And people were saying this all along, that it's not about the vaccine, it's about the vaccination. And so
Right.
vaccine is there, but man, they're having problems nationwide with the actual vaccination.
Yeah, we are. And we're seeing that same thing in Washington with only 20% of the vaccines that we actually have even being rolled out, prioritizing healthcare workers. But we've also prioritized another group that I thought was really interesting, and that is high risk prisoners in the correctional facilities. So we've actually prioritized vaccinating our prisoners in Washington State. And when they were asked kind of what was their reasoning behind that, they said it's just the same as an elderly care facility. It's that it's a lot of people living in really close quarters, and you have workers like guards and administrators and stuff who are coming in and out of the prison and the prison systems, and they're bringing COVID with them. So we've actually prioritized the prisoners in Washington State, which is a little different than other states.
Yeah, I mean Airway Heights over in Spokane. I was reading the Spokane Statesman, and I think it said it was like 1,400 COVID cases there in the prison over there in Spokane.
It's really bad, and we actually just lost our second correctional employee, like corrections employee, to COVID today. So it's like a petri dish, just running rampant through there, and the guards really are at the mercy. Or not the guards, the prisoners and people who are being held are at the mercy of these guards taking social distancing measures when they're outside of the prison. Because they're bringing it back, and there's nothing that these prisoners can do. And a lot of the things that they are doing are pretty crazy. A lot of solitary confinement for people, canceling recreation times, things like that, in order to control the virus. So they're being punished on top of being put at risk for the coronavirus. It's pretty wild. So I'm glad that we are getting those vaccinations into the prisons and prioritizing that
Right. And
population.
I would say one thing, especially when we talk about the governor now moving the goal line from January 4th to January 11th, is that a lot of people just have quarantine fatigue. A lot
Yeah.
of a lot of people are just they've got fatigue, and we put a lot of emphasis, Nikki Barron, on on the virus itself, or treating people, treating symptoms, and testing. But there seems to be so many other issues around COVID. People dealing with isolation issues, people dealing with mental health issues, people dealing with loss of income issues, and I know resources are out there, and this is really what this show is about. I know some resources are out there, but I don't think a lot of people might, one, realize that they're actually suffering. A lot of
Mhm.
times if you're suffering with something, might not realize you're depressed, or you might not realize whatever. But COVID is causing so many other things that aren't traditional hospital go, get a test or go to the doctor. And it would be good to know, or it's good, and hopefully we'll be able to shed some light today on what resources are out there for people.
Yeah, absolutely. I know personally I'm experiencing that. I was just having a conversation with my boyfriend yesterday because, I was texting you about how like I had my car got towed and his car got broken into and then a pipe burst and all these things were happening. And I was talking to Chris about it and I told him, I said, I had this realization that I've been sort of at like medium grumpy for the last like month, but because we've been dealing with this stuff for so long, it kind of took a really bad day, like one of those days that you're just like, I want to go to bed and start this day over, days for me to realize that I've been sort of a grump for like a month and that this sort of low grade hum of bad stuff had been affecting me daily. And he was like, yeah, you're pretty grumpy. But, you and I were texting and I was, talking about that. And then you brought up the congressman who passed away. He was supposed to be sworn into office this weekend. And, he passed away at 41 years old, had a family. And so it was just one of those like wake up moments for me where I just was like, I'm just blessed to be alive. I've, just like everybody else, running out of savings, running out of things, running out of patience for this quarantine. But it kind of took one of those like no good, very bad days to like shake me and be like, Nikki, what is going on here? Like, get it together. Let's start this over. And I get that. I'm learning that trait from you, where you wake up every day and start fresh like it's a new one. So
go.
Yeah. And, I'm excited about learning about these resources today because, like I said, I'm in that same boat. I've been only partially employed. This is the longest I've ever gone without being like a full-time employee somewhere, ever, I think. So, I've been partially employed working with you here at Converge. But yeah, I mean, these resources are really interesting. So I'm excited to hear about them.
Great. Why don't you tell us about today's guest?
Yes. So we've got today's guest, and I see Callista is in the green room. So this is Callista Kennedy. She's a program manager for King County Public Health Access and Outreach, and she's going to tell us all things King County Health resources that we can tap into.
All right. We're going to take a short break. When we come back, we're talking to Callista, watching a coronavirus update show. Welcome back to the Coronavirus Update Show. My name is Omari, Salisbury, joined by Nikki, Barron, and we're joined right now by Callista Kennedy. How are you this evening?
I'm great. Hi. Thanks for having me on.
Good to have you. Good to have you. Nikki, Barron.
Hi, welcome to the show. So why don't we just jump right in? And I want to let you tell people who you are and what exactly you do for King County Public Health.
Okay, so I am a project program manager for Access and Outreach team for the Health Navigator program. So at Access and Outreach, what our mission is to bring benefits and services to the public in an outreach fashion. We kind of do a one-stop shop model where if they come in for one of our services, we see how many other services or resources we can connect them with. So what we do is we manage the Navigator network for King County. We also do Jefferson and Clallam County for health insurance enrollment through the exchange. And so my role is I help manage the Navigator network here in King County. We have about 300 navigators that include our hospitals, community-based clinics, and other service organizations. So I kind of manage that network, make sure everybody keeps up with their training. I help with what's called enhanced users. We have back-end access to help remove error codes and assist people in getting their applications completed. But I'm also a certified navigator myself, so I assist people in healthcare enrollment. Our department also does about 8 or 9 other programs that include the OrcaLift transportation programs, basic food assistance, any other DSHS application assistance, and then Washington breast, cervical, and colon health, and then energy assistance through the city of Seattle. So we have a wide variety of programs that we help people with, and some of it is actual implementing and inputting application and doing the eligibility components, and some of it is connection and referral. So it's kind of a combination of both that we do for folks that are looking for assistance. And like I said, it's mostly King County, but some of our programs extend beyond our King County borders. We help who we can.
So to get access to, you said there was 9 programs. What's that process look like? Like, say I was interested in the utilities assistance program.
Mm-hmm.
Do I just go and apply? Do I get a navigator? Kind of, what does that look like?
It can actually work either way. So usually someone either calls our phone line. We have 2 what we call storefronts, which are walk-in locations that are still open with social distancing, of course. And they come to us seeking some kind of resource. So if it's utility assistance, we have to do a screening because we are contracted with the City of Seattle programs, but people outside that have to go to another agency that's processing them. And so if they're not one that we can actually do the application process itself through the city, then we connect them with the appropriate service agency for their zip code area. And so from that, if someone said, hey, can you help me? And we're helping them with the energy application. So we're looking at their income and their household composition. And then we would say, okay, well, you asked for energy assistance, but, did you know you can enroll in OrcaLift? Do you ride the bus and do you need transportation help? Or do you have insurance? Can we help you with your insurance needs? So we just try to touch whatever program they could potentially be eligible for based on what we're seeing when they first come to us. So, we have people that come to our storefront for an OrcaLift card and they walk out of there with their health insurance enrollment completed, their basic food application started, and they just need to follow up by phone with DSHS and an OrcaLift card all at the same time. So we try to touch as many programs per individual that we can whenever they come to see us or even call us on the phone.
And where are these storefronts located?
We have one that's in the King Street Center right next to Metro's customer service. That's at 201 South Jackson Street. And then our other storefront is in Federal Way. It's located in the shopping plaza that's across the street from the Commons Mall. It's the one where there's the Hometown Buffet and Trader Joe's. That plaza there on 318th, South 318th Place in Federal Way.
And you said people can also call and do this process over the phone. Do you have that phone number or?
Yeah. It's called our CHAP line, which is Community Health Access Program. And that's the 800 number is usually the easiest way, which is 800-756-5437.
Great. So let's kind of go through what's available. So far I've heard you mention you can get OrcaLift cards. And is that one of the income-based programs, or how does that one work?
Yeah, so OrcaLift is a reduced fare program. It gives the adult in the household essentially youth rate. It's good on Metro, Sound Transit. It includes the light rail, the Seattle streetcar. Kitsap Transit is also honoring the Lyft discount. It even gives the foot ferry a discount in Kitsap County. It also, Community Transit has a 2-zone Lyft discount. If someone qualifies, they get $2 for multi-county or $1.50 inside Snohomish. And then Everett Transit goes down to their youth rate, which is $1.25, whereas King County's Metro and Sound Transit is $1.50 for youth. And to qualify for that, folks can qualify one of 2 ways. One is by income. It has a federal poverty guideline of 200%, which for a single adult, that would be $2,127 per month. We just look at the last 30 days worth of income. So if you qualify in 30 days, you get a card that lasts you for 2 years. Whereas, if you come to us and say you got some Christmas bonus hours and maybe you don't qualify in the month of December, but that went away in January and then you qualify in January, when we gave you a card in January, that card would still be good for 2 years and we don't need to re-verify in that time frame. You can also qualify by program. We have designated programs that if you're already eligible for it, that automatically qualifies you for LIFT. So that's the Washington Apple Health Adult Program, and then Basic Food, also WIC, are all programs that if your benefits are open, and since we're navigators and connected to those systems, we can see that eligibility. We're contractors with the state basic food program so that we can assist people in applying for and obtaining basic food benefits. So we can see the eligibility when you enroll through us. If you're open, we simply look you up. It shows us open, we issue you a card. OrcaLift is probably one of the simplest programs to get enrolled in, because it's kind of like a minimalist view. What's the least amount of information we need to take from you to get you this card? So whether that be say, hey, are you on Apple Health or do you need to sign up? And that's kind of where those ties come in. Someone comes for OrcaLift and they say, hey, I'm not working right now and I need the card to look for a job. We'll say, have you enrolled in Apple Health? We can do that for you today and do both at the same time. So we kind of like to try to touch as many programs as we can when we have someone come to us for help.
So you have the OrcaLift help, card help. You just mentioned healthcare. So is it just enrolling in Apple Health or is it its own separate program? Can you tell us a little bit more about getting healthcare through?
Yeah, so through the Washington Health Plan Finder, there are 2 programs that it looks for simultaneously when it looks for enrolling people in health insurance. Apple Health is our state Medicaid program, and that's for low-income people, and it's free coverage in Washington State. And so if folks meet the income criteria, there's also some citizenship and permanent residency criteria that we have to look at because that's a federal program. If they meet the eligibility criteria, they can qualify for free insurance in Washington State. Then what the system does is if someone is over income or perhaps doesn't meet maybe the federal citizenship guidelines for Apple Health, it looks at the qualified health plan system. That's what everybody refers to as Obamacare, or the qualified health plans that were established through the Affordable Care Act, where people can get the assistance through the tax credit system from the IRS to pay for insurance. So it looks at those at the same time, and it determines the amount of help based upon the household size, income, and the eligibility criteria that's set forth when people enroll. Now, with the qualified health plans, we have what we're in right now, which is open enrollment. And really what that is it's a period of time every year where anyone can enroll and shop for health insurance. Otherwise, when you buy insurance companies like to lock you in for a year. That's how they meet their bottom line. And it also gives you continuity of care by buying an insurance and sticking with it for a year. So generally it runs in past few years, it's been from November 1st to December 15th. This year, we added new plans in Washington State through a program they called Cascade Care, which gave people some additional options, gave people more upfront benefits, benefit programs where they don't have to meet deductibles all the time to get, primary care and prescriptions. So since those new programs rolled out this year, our open enrollment actually does not end until January 15th. So we have another good 2 weeks to still enroll people here for coverage for the 2021 benefit year if they have to purchase. Whereas if they're Medicaid eligible, you can sign up for that all year round. During the year, people can have events. Everybody's had a life event, I think, this year with COVID. Yeah. And whether that be losing a job, losing health insurance, things like getting married or having children, having babies, those things can allow you to enroll at different times of the year. But mostly we do it during this open enrollment season as far as those qualified health plans. The rest of the year, it's a lot of people have losses, which actually make them eligible for the free Apple Health program versus having to enroll in and purchase a plan during other points of the year. So we do that program as well. And like I said, we service King County. This year, we've also taken on Clallam and Jefferson County because of all the changes and the service agencies there having, to deal with reductions and things like that, really not having a steady lead in those two smaller counties that we've taken on that role for them as well.
Right. And so we also talked a little bit about utilities assistance. Mm-hmm. Is that all the utilities? Can you break that program down and how people access that?
So basically what we have is we have a program that's called LAHEAP, which is the Low Income Energy Assistance Program. And it used to be winter heating assistance. It used to only run from mid-October. Sometimes it would roll to November 1st, depending on the feds, because that's where the money comes from, through June, through the end of May or June. However, with the COVID onset, and then they changed some regulations for that program, it now runs year round as well. And so basically what that means is now once every 12 months, a household can qualify for a one-time payment of minimum of $100 up to $1,000 on their heating source. So whether that's gas or electric, that heating source, they can qualify for a one-time payment. That program has service agencies that are determined by our state's Department of Commerce and Utilities, and is determined by zip code. And so basically, because we work with the city of Seattle, the contractor for the city of Seattle, which is the Bird Bar House, there on 18th near downtown. Yeah, the Central District. We work with them so we can help do direct application help for their program, which is, really nice. We can get the applications out to people. We can help them completely complete them and get them into that agency. Versus some of the other contractors like Multi-Service Center and HopeLink that do the South King County and East Side. Their preference is that we just do the connection, which means we will help them. They all now have some form of phone appointment, but they also have online scheduling where they can actually schedule the callback appointment online. So what we do is we make sure that people are able to get the appointment scheduled, and also that they're aware of what they need upfront and materials that they need to gather before their appointment happens, so that they can get through the appointment process as smoothly as possible, since we don't do the actual applications for that program. So we try to help with all of the contractors that we can when it comes to utility assistance. The city of Seattle has another program, which is an ongoing discount program called the Utility Discount Program, where they now have an online portal, which is really nice, where we can enter all the information online, and then it would be processed usually within about 15 days. And what it does is it gives an ongoing rate reduction, so people really do see a reduction in their overall bill when it comes to that Seattle City Light discount program. So we help people, connect with that program, again, making sure that they have their proper documentation and that everything is entered into their system correctly, so that people don't have trouble getting through and actually getting on that program. So
on that, I know on that utilities one, here in Skyway, I know it's really common. We have oil tanks. Mm-hmm. Does that qualify as well for the heating source utilities discount?
Yes, they do. I think it's propane and oil. I've seen the oil thing is a little.
Have that.
Yeah, the oil thing is a little strange because it can be difficult sometimes if people don't keep. Because it's not like the utility providers like Seattle City Light or Puget Sound Energy, where they have the ability to contact them and pull the usage history, because they do pull a usage history. So I know sometimes with people with the oil heating can have a little bit of a tough time, because people don't necessarily do a good job at keeping the receipts needed to track the usage history. And that can sometimes be tough on folks, is to try to help them get that information.
Yeah, we had a comment. She said, "Woo, oil heat expensive." Oh yeah, it is. I spent
very expensive.
About $800 a year to
Yeah.
fill my oil tank, and I only have an 800 square foot house, so I'm not like living in a mansion over here. Okay, so we've talked about utilities. What else is there? What else? I mean, and I'm so glad that you guys have navigators, because I'm already confused, and we've only covered 3 areas of resources.
There's quite a bit of there. Yeah, there. I mean, and you know, it's funny because it does get to be overwhelming, and sometimes we're just like, you know, let's deal with the most emergent need right now, and you can always call me back later. You know, I mean, there are a lot of people we talk to multiple times. But you know, the other things, like I said, we do we do the EBT applications, and so, you know, with DSHS being,
and what does DHS stand for?
I'm sorry.
What does it stand for? The
EBT?
DHS.
Oh, DSHS. Yes, I'm sorry. I apologize for my acronym usage. DSHS is the Department of Social and Health Services. Okay. So this is where people are used to going. You know, they used to call it the welfare office. You know, it's where you get your EBT food, basic food benefits, cash assistance. They also do childcare assistance for folks that are elderly and on Medicare. Certain people that are on the Medicare but still have a pretty low income can apply for help programs to help with their out-of-pocket costs for Medicare. And those applications can be submitted through a portal called Washington Connection, direct to DSHS. So we assist in putting those benefit applications through that system so that people can access it, especially right now with the offices being closed and everything being on the phone. If we can get the applications for the program started and submitted through the electronic system, it's a lot smoother process to get in. There's not as much time spent on the phone because everything is entered prior, and so it's an easier route for folks, and we like to kind of cut down on that time that they have to spend on the phone with doing that interview process when it's necessary. So we do those as well. And, you know, basically one of the things that we've of course seen an uptick in is the applications for EBT basic food. You know, food insecurity was already too high before COVID hit. And, you know, it has gotten somewhat, you know, worse as this has continued on throughout the year. So we have seen an increase in people applying for food assistance. So we try to make that process and assist in that process in any way we can.
Yeah. And when you guys, so, you know, there's all these programs, you guys basically are, if I'm understanding this correctly, intermediaries that help navigate all the complicated process. Do you guys also have interpreters to help people who don't speak English?
Yes, we have, I want to say it's 11 or 12 staff of our staff that actually, it's about half that actually speak Spanish. We also have on our team Chinese, Vietnamese, Amharic, Somali, Korean. I think I'm forgetting one. I said Amharic, right? I think I'm forgetting somebody, but we have those actually on staff that speak those languages. And then we do have an interpretation line for other languages that we need.
Wow. And so I mean, there's so many programs. When someone comes to you for one of these meetings, what are sort of the main things that you recommend people bring with them, or, you know, have ready to talk to you about on the phone?
For most of our programs, it's household members, names, dates of birth, and social security numbers, and then knowing your income. Those are the main components. Most of the time, if people have that information, we can get them through multiple applications at the same time, if we need to. Sometimes with immigrants that are green card holders, we recommend that they have that on hand. Depending on the program, we don't always need that, but it's when you can, come in for one thing and end up with something else. Sometimes it's good to have on hand just in case. But the main things are knowing, like I said, everybody's names, dates of birth, social security numbers if they have them, and then knowing your income for the household.
And if you don't have a green card, if you are an immigrant that's not here under a green card, do you have programs for them?
At times, there are some gaps that are created when someone is undocumented. But for some things like, for example, basic food, you can't qualify for yourself. But if you have children that are, U.S. citizens or lawful permanent residents, your household may still receive a benefit without it would be a lesser amount, essentially, because they would exclude the person that doesn't have documentation. There are not necessarily all the insurance options available to someone who's undocumented, but there are certain programs that they may be eligible for example, minor children or pregnant women for our state. If there's an emergent medical condition, there's an emergency medical program for that. So there's not all the programs available, unfortunately, but there are some things we can keep them in contact with. Utility assistance programs through the city don't have a requirement, or the LIFT programs don't have the requirement. One of the other programs we do is the breast, cervical, and colon health program, which helps 40 individuals 40 to 64 for get mammograms. And then we were doing some colon screening. Our colon funding right now has not been reapproved from the state, but the colon portion, but we generally can help women get mammograms and cervical screenings through those programs as well. Also, the state now has family planning options available regardless of citizenship or immigration status. So, like I said, there are options. Unfortunately, not as many options, of course. We always have program restrictions, especially things that come from federal funding that always have those citizenship and immigration criteria. But we do have some resources that we can access here in King County.
What uptake have you guys seen in all these services that you provide? I mean, are you able to make any correlation between the services or the number of people that you were serving, or the services provided like pre-COVID and since COVID? Mm-hmm. Have you seen a gradual increase in certain services?
Yeah, what we saw over the summer, particularly, we saw at first a big jump in folks calling in and seeking basic food assistance. We had a period through mid-June to probably the beginning of August where we were seeing a lot of numbers. That's kind of leveled off a little bit as we've gone through this. Definitely, though, I would say we can say we are getting energy assistance calls. Even with the moratorium on shutoffs, people are doing their best trying to not let those bills go sky high because they know eventually they're going to have to pay it. And so that is something that I think is a direct correlation of this. I mean, it's the lack of income for some people, but then also the staying at home causes an increase on your energy bills. So, as the winter has come on, we are seeing an increase in that. And I would think that's definitely a correlation there to what we're seeing, particularly among those two, the needs for those benefits as we continue on in this COVID world.
Do you have any new programs that are new that have rolled out specifically because of the coronavirus? Or are you just basically older programs that are sort of morphing to suit the need?
Yeah, pretty much. It's the existing programs that are changing and modifying themselves. The county did have some funds where they were doing financial assistance for people who had tested positive for COVID-19 and or quarantining because of COVID-19 and were unable to get paid leave. So they didn't have any sick or vacation time, essentially. There were some other program requirements. However, because of the regulations from that money coming from the CARES Act, it had to be spent by today. So they stopped actually taking applications for that on Monday. We're still waiting to hear, of course, with everything going on, if that's going to be extended into 2021. But other than that, it is basically, even with the teams that are working on the contact tracing and the resource connection through contact tracing, it's really how we can get them connected through our programs that already exist that are there to provide the assistance that they now need because of COVID.
Right. And so how do people catch up with you? Is there a good website where they can find the phone number, a list of resources, all of that?
Yeah, if they go to kingcounty.gov/outreach, that's our access and outreach page, and there are pull downs and links to all of the services that we provide. And then if they scroll to the middle of the page, because it's still open enrollment, there's a little banner that says Health Insurance Open Enrollment Event Calendar. Above the calendar, there is also a fill-in form that goes directly to our inbox. We have our own inbox for this. And if they need, an insurance, someone to call them back for insurance, someone to call them back for energy assistance, or whatever, they can put in the box, in the comment and question box, what they need. We'll get them assigned to a navigator. That navigator will call them back and walk them through whatever services they need.
And what's the wait time on that right now? So if I went today and signed up, how quickly would I expect to hear from a navigator?
It's usually by the next day. Some people, yes, you can actually put in a date when you want called back. So we've had some people put in, that they want called back until Saturday, or that they want called back next Monday. And then we just set it up. We have a calendar that we put them on, so it sends both the navigator and them an alert. And we just use that. But some people will say, can you give me a call after 1 p.m. today? And we just find a navigator that's open and have them get in connection with them. So
that's great. It's so fast.
Yeah, and we've used this in a multitude of different ways. We've used it for phone calls with clients. We've even set up Zooms with clients, so that they can actually see what we're doing when we help them with health insurance and things like that. So it's been a great tool. We've only been using it for about 4 months now, but it's really been a great tool to get connected, because we're used to seeing people in person.
Yeah.
We're used to seeing people in person. And I think that's been the toughest part of that, actually, for our staff, is not seeing people in person, because that's how we used to working with folks. So, like I said, Zoom's been a great tool for us. And that's mostly how we're connecting with it. We do have, if I can give a little plug here we have been doing during open enrollment, some in-person events. We used to call them health fairs because we used to have a ton of services. We're not able to do that this year, but we do have one coming up next Saturday on the 9th at Highland Park Elementary School in West Seattle, where we will be having flu shots. We will be having COVID testing, health insurance enrollment navigators, and we will also have the Swedish mammography truck out. And so we still have appointments. If someone wants to call our 800 number and get an appointment for a mammogram next Saturday, we still have a few appointments available. But we kind of provide, like I said, our one-stop shop model. They can come out, social distanced. We even carry our own sneeze guards, so they can sit on the other side of the table with us, and we can help them with whatever services they need. They get a flu shot, a COVID test, get it all done there in person. And I don't know and we always have a food truck that we pay to do grab and go, so they can even get a free lunch. I don't know what food truck is coming though next week. I'm sorry, but we would love to see people come out. This is the third one we've done. We had one in Federal Way, we had one in Tukwila, and now this one coming up on Saturday. Oh,
Omari.
we had a Skyway one. We had a Skyway one. I forgot.
Yeah,
that.
right by my house.
Yeah, we had a Skyway one too. So
yeah, I drove by. I was like, "What's happening?" There's this huge line of cars like going through the parking lot. It was great.
Yeah.
Oh, did you have any follow-up questions?
No, I think you hit everything.
You know, Callista, if all the navigators are as calming and reassuring as you are, I think people will have a good experience, because I feel very calm after talking to you about all this, even though that was a lot of information.
Oh, thank you. Yeah, it is. Like I said, it's always a lot. And like I said, and all of us are like, whenever we talk to somebody, here's my phone number, here's my email. When you go home and you think about it, if you need to call me and ask me 5 questions, just give me a call. So
that's great. That's a really great program. Thank you so much for your time today.
You're welcome. Thank you.
Thank you, Callista.
I like her.
They got a lot of stuff going on. I think that a lot of times people are like, systems are too difficult, the barrier to entry is too high, and all these kinds of things. It doesn't sound like, it sounds like they've lowered the barrier to entry on a lot of this stuff as low as possible. So on the flip side of it, people who want services or need services, if they're able, they need to do their part, because clearly the county is doing their part to lower the barrier to entry to these programs.
Yeah, it sounds like the programs are still really complicated and kind of hard to navigate, but you have one person who knows about all 9 programs that are available. And not only, they'll tell you what you don't, like what you don't know. Like, and it's amazing because it's like, yeah, like we didn't even get through all the programs. Like we only got through 4. And I know when I spoke with them through email, there was 9 listed, but we were just running out of time. And I was like, this is amazing though. And I'm really glad that people can do that and tap in with these navigators. Yeah. And that's just one area, that's just King County. There's also resources through the city, through the state, federal resources, community-driven resources. So hopefully we can keep bringing them to the table. So if anybody wants to tell us about their favorite COVID resource in the comments, we'll reach out, see if we can get them to come on the show.
All right. So, producer Nikki Barron, this is the last coronavirus update show of 2020.
Yeah, it feels good. I feel like I've been doing it forever. It's only been, like 2 months, but not even 2, well, I guess, 2 months. But yeah, no, I feel like this is just part of my life now.
Man, you know what? You've been consistent and you've been dedicated, and the show keeps getting better and better as far as the information and the guests and time. Man, you're doing a good job, Nikki.
Thank you, Mark. So are you. I appreciate you being my co-host on this. I've never hosted anything before, so it's really nice to have such a seasoned co-host to help me.
I just show up and do my part. Look at this, they're loving you too. So we're back at it again tomorrow for the last morning update show of 2020. And man, what a growth curve the morning update show has had this year.
Oh yeah. I remember when I started with you, we were doing it like in a place we called the bunker, and we were just, or we were doing it outside on the street.
Outside on the street, yeah.
And now we have a studio and we have a director, and yeah, it's pretty amazing. It's I love it. I mean, I like the morning show, so even if I wasn't working on the back end of the morning show, I would tune in. So I think it's a good show. Great job, Bo.
Yeah, well, thank you. So you guys can catch us tomorrow morning at 11 a.m. right here, wherever you're watching this, for the morning update show. And until then, peace.